This video will take a look at some of the common abbreviations that you will find in pharmacy practice. Some of these abbreviations will be found on prescriptions in the community setting, and some of these abbreviations will be found on medication orders in hospitals. Now, the best way for you to learn these abbreviations is simply to pause the video and spend a few minutes going over these abbreviations and their meanings that I have written next to the abbreviations. The first column takes a look at dosage forms. So if we take a look at different dosage forms, we have tablets and capsules, elixirs, suspensions. I've also written over here SOL. SOL is abbreviation that can be used for solution. We have syrups, we have ointments. The more common abbreviation that you will see for ointment is this first one over here, OINT. However, sometimes you will also see UNG for ointment, and this is our cream. We also have various routes of administration or ways to get drug into the body. Anytime you see otic or otic, it means something that is for the ear. Ophthalmic is something that's for the eye. We have suppositories that can be used for the rectum, vagina, or urethra. You may see SQ, SC, or subQ, and that's for a subcutaneous injection, which is simply a shot that you receive in the fat pad beneath the skin. IM is for an intramuscular injection. IV, something that you'll see in the hospital, is for an intravenous injection or something that's administered right into the bloodstream. And PO are medications that are given by mouth or, simply given orally. Now, there's also a lot of abbreviations that deal with frequency. And some of these abbreviations are listed here. These are just some of the abbreviations that I thought of quickly that you will find on both prescriptions and medication orders. Anytime you see Q, it means every. So we have medications given every day or every other day or in the morning or in the evening. If you look over here on the right side, we have Q4H and Q6H, or we also have the little grease symbol here as well. This means every 4 hours or every 6 hours. And you can substitute any number in place of 4 or 6 and still get a direction used by physicians and pharmacists to mean a medication that is given every so many hours. You can use PRN for medications that are not scheduled, such as pain medications, which may be ordered every 4 hours, every 6 hours. And if the order is given for PRN, the medication can be given every 4 hours or every 6 hours, but it's only given as needed. In the case of pain medication, it's only given as needed for pain. So the patient is not in pain, the patient does not necessarily have to take the medication every 4 to 6 hours. But it's important to remember that they must wait at least every 4 to 6 hours in order to take the medication again, should they need the medication. If you look back on the right side, we have BID, TID, and QID, and this simply means twice a day, 3 times a day, or 4 times a day.
very common abbreviations that you'll see on prescriptions. HS is for bedtime. The bottom three on the left, AC, PC, and WF, simply concern medications taken around mealtime. So AC is before meals, PC after meals, and WF means with food. At the top you'll see C bar and S bar. Sometimes you'll see these written without the bar on top, so C or S, and this means with or without. An INJ is simply an injection. And per means by, so if a medication is given per rectum, it's given by the rectum, so the patient is to insert a suppository into the rectum. And UD is simply as directed. A common medication that is given as directed is a Z-Pak. A prescription may come into the pharmacy that is Z-Pak UD, and the pharmacist knows what the UD means in this case for a Z-Pak. It means that the first two tablets are given on the first day of therapy, and the remaining tablets are each given one per day. And a Z-Pak is a 5-day course of antibiotic therapy. Again, the best way to learn these abbreviations is simply pause the video and take a look at these abbreviations. These abbreviations are not all inclusive, and if there are ones that that I have forgotten, we'll include them in examples in subsequent videos in this series. And if you're looking again for the first set of abbreviations, here they are. You can simply pause the video at this time to look over abbreviations for dosage forms and routes of administration.